I think there's a couple of different things going on, right?
Yeah.
So the first is that you have what we call congenital stenosis, which means that your spinal canal is a little bit smaller than a normal person's, and that's just how you were born. And for the most part, people usually don't have any issue with that, but as they age, what can end up happening is that you can develop arthritis in your spine that causes some narrowing of that spinal canal. And because your canal is already more narrow than a normal person's, it's starting to affect you a little bit earlier, right? Because you're only 43. You know, that's pretty early to be having this type of problem. Now, in your case, there's sort of two areas where the narrowing is the worst. It's going to be at the L3-4 and L4-5 levels, right? And part of the reason why the arthritis here is so severe is that when we actually look at your x-rays when you are standing upright, we can see that there's pretty significant motion at both of these levels, right? At the L4-5 level, you can see that you have what we call a slippage here, or spondylolisthesis. And then at L3-4, it actually looks okay, but when you lean forward, we can see that there's a little bit of a slip here now, and then the angle here at the L4-5 level has changed significantly, right? And then when we go back into extension, you are sort of back in a more normal position. And so we can see that these two areas are fairly mobile. So they're shifting as you stand upright and you lean forward and backward. And what that ultimately does is it causes, you know, this kind of arthritis to build up in these two areas at L3-4 and L4-5. Okay. So what that means is that because there's such severe narrowing in the spinal canal at these two areas, that is likely contributing to your back pain, and it's also contributing to the leg symptoms as well, right? And I think the instability in the spine in those two areas is also probably contributing to some degree to the back pain. Now, in general, for something like this, we usually recommend conservative treatment first. So that includes PT, that includes injections, that includes medications. It sounds like you've done most of those things already, and nothing is really working. So really the next step at this point is to consider surgery, right? Now, surgery for something like this is a little bit tricky. And the reason why I say that is that normally, if it were just the narrowing of the spinal canal, we could probably do a smaller operation called a decompression, where we go in and we basically drill out the back of the spinal canal to open up the space there. And that would relieve the symptoms of the nerves being compressed. But because you have instability of your spine in those two areas, if we just do that alone, there is a chance that it's probably going to fail down the road, right? You may have a few months to even a year of good pain relief, but going forward, because of that motion there, that arthritis will probably build up again, and you will probably have a similar issue moving forward. So in general, for something like this, if there is significant instability associated with this, we usually have to do what's called a lumbar fusion. Right. So now a fusion is a surgery where we basically go in and we fuse the vertebrae together so they no longer move, and then we do the decompression where we take the pressure off of the spinal canal of those spinal nerves. Now the way that we would do a fusion like this is we would probably do what's called a lateral interbody fusion. So what that means is that we would make an incision on your side here. We would then come down to the side of the spine at L4-5 and L3-4. We would then remove the disc in its entirety and then put in a large cage or spacer that contains a little bit of cadaver bone. And over time, those vertebrae will actually fuse together. Okay. We would then flip you onto your stomach, and then we would put in screws and rods from L3 down to L5 to lock those vertebrae in place. And then we would do what's called a laminectomy, where we open up the space around the spinal canal. So it's not a small operation. It's probably about 3.5 to 4 hours of actual surgery time. You would be in the hospital likely 2 to 3 days afterwards, which is pretty standard. And then the last thing, you know, basically following your discharge, you would follow up with us at 2 weeks, 6 weeks, 12 weeks, and then 6 months. We get x-rays at each of those stages, and then around the 6-week mark, we usually have you start a little bit of outpatient physical therapy. By 3 months, you're sort of back to doing everything you were doing beforehand. Okay? All right. So do you have any questions? I'm sure it was a lot of information.
Yeah, let me discuss with my mom.
Okay.
When I go home.
Okay.
I'll let you know.
Yeah, no problem. If you want more information about the surgery, what I'm going to do is I'm going to dictate it into my note, and you'll be able to look it up afterwards. Okay? All right. Any other questions I can answer for you?
No, that's it. Thank you.
Okay, perfect. Well, it was nice to meet you. Let me know if there's